Good morning and welcome to the Introduction to HCA Healthcare Benefits for North Carolina Division colleagues. This will tie into the transfer of information that will take place January 1, 2022. Today we're going to talk about your health benefits, medical, prescription drug coverages, behavioral health benefits, dental and vision, flexible spending accounts, life and disability. We're also going to talk about your finances, which includes some supplemental health plans, the 401k plan, and even the employee stock purchase plan, which some of you have likely already enrolled in. Lastly, we'll talk about your life, which is education assistance, well-being resources, time away from work program, and the Core Plus benefits and some other benefits that are available to you. We'll also go over some ways for you to enroll. That will take place a little bit later in October, giving you the opportunity to elect your benefits for January 1, 2022. So, some benefit eligibility information. Full and part time colleagues are eligible. There's not going to be any waiting period for those who are hired by Mission Health Systems or North Carolina Division by December 31st, 2021. Any colleague that's hired after December 31st, 2021 will have a 30-day waiting period for their benefits to be effective. PRN benefits are available for colleagues who meet the eligibility requirements for ACA or the Affordable Care Act. So we use a 12-month look back period that will begin October 3rd, 2020 through October 3rd, 2021 to confirm that eligible PRNs meet the 1,560 hours or 30 hours a week eligibility to be eligible for benefits. Those that are eligible for PRN benefits will receive notification from Be Connected upon the review of the look back hours for these colleagues. For the 401k plan, it's a little different. There's not going to be a waiting period for anyone hired as of December 31st. That's the same as the health plan. However, those colleagues that are hired after January 1st, on or after January 1st of 2022, will become eligible the first of the month following 2 months of consecutive service. So while this doesn't apply to those of you, most of you that are reviewing this presentation, this will apply for anyone of your colleagues that are hired after December 31st, 2021. And then all colleagues, full-time, part-time, or PRN, as long as you're as of age 18, are eligible to participate in the 401k plan, except for those in a temporary status. So, some of our benefit strategy that HCA Healthcare uses now, we're certainly HCA Healthcare is committed to offering benefits that are fair, smart, and competitive. And you'll see that a lot in the communications that we send to our colleagues for enrollments, for changes of eligibility, things of that nature. Um, for fair, colleagues who use healthcare services more are going to pay more for the benefits, and they're going to pay more out of pocket instead of everyone taking on that additional pay in their paycheck deductions. Our plans are smart because it really encourages colleagues to use the appropriate level of care, doctor's offices versus urgent care and ER. And the prescription plan is designed to help colleagues make smart choices and even save money. Lastly, our plans meet and in fact exceed all government requirements, which makes us very competitive in the marketplace. Some new information that may not have been informed to you at this point. The North Carolina physicians that are currently a physician with the Mission Health Systems or other North Carolina facilities, if you're an employed physician, your eligibility for certain benefits may vary due to current agreements or regulatory compliance. So it's important to refer to the enrollment materials that will be sent to you for information about the benefits that would apply. So, the HCA Healthcare Total Rewards Package is designed to support your health, life, career, and retirement. When you go into HCA Rewards, you're going to see a lot of information that will provide you some details about the benefits that we offer, the benefits that you are eligible to enroll in, and how to elect those coverages based off of your needs. So, let's talk about your health a little more in depth as far as the benefits that are available to you. So let's take a closer look at how your medical plan costs are determined. All plans cover office visits, inpatient and outpatient care, and prescriptions. Now, they differ in the amount you pay for coverage, your cost when you receive care, and how care is covered. For example, in network versus out of network. You pay your portion through paycheck deductions and out of pocket costs when you need the care. You choose which plan fits your situation, either more cost per paycheck or more cost when you need care. If you enroll in a WellCare medical plan and you attest to being a non nicotine user, you will receive a $25 per pay period discount on your medical coverage for 2022. It's very important to know that each year during annual enrollment, you must reattest to receive this discount for the following plan years. It does not carry over. So, how the WellCare medical plan works. One of the biggest pieces of this presentation that really want to draw attention to is the cost of coverage. HCA Healthcare pays most of the cost of your coverage, actually 73%. And then you pay the 27%. Now, your cost is through premiums, which is the deduction from your paycheck, either biweekly, monthly, or weekly, and your out of pocket costs, which includes copays, deductibles, and coinsurance. This slide just gives you an idea of kind of what to expect when you transition to HCA healthcare benefits and some things that you can expect to be free, like preferred generics, in network preventative care, and annual physicals. It's very important to maintain a good health. So we encourage you to take care of these options. Certain vaccines and screenings, such as mammograms. And then when you look at the copay, it's really a low fixed price for most common services when you use network providers and HCA healthcare facilities. Coinsurance is really for the remaining services, or if you seek care from an out of network facility, you generally must pay a deductible first. More information is available to you when you make your elections, as well as if you go to your carrier's website after 1/1/2022, you can look up specific details related to the care and certain services that you need to receive. So this chart is kind of shows some of the most common health services and how much you'll pay if you are assigned to our well care plan options based on your location. So the claims administrator for your benefits will be Aetna, most likely. Some may actually have United Healthcare, depending on your location. If there's a copay listed, that's all you pay. You don't have to meet the deductible before the plan pays the remaining cost. If there's a percentage, also known as coinsurance, you will pay the full allowable amount for the service until you meet your annual deductible. Then you'll pay the percentage listed, and the plan generally pays the remaining cost. It is important to note the tiers for the facility services. You will have the best benefit by going to an HCA healthcare facility for services. If the services are not available there, then you can use either a Aetna or United Healthcare, depending on your carrier, network facility. You'll need to call prior to services to ensure the network level benefit. So prior to receiving any services, please contact your service provider, either Aetna or United Healthcare, prior to receiving any services so that you can ensure the network level benefit. So let's talk about maximizing your health benefits. I've already mentioned it's important to use an HCA healthcare facility, but it's also important that you use an HCA healthcare provider. And if one's not available, a network provider listed in your claims administration website for the best benefit on professional services. In all circumstances, if an HCA healthcare provider is not available, you really need to make sure to call your claims administrator prior to services being rendered to ensure the best benefit. So, some key information about transition of care: if you're currently seeking treatment at a physician who's not in our new providers network, you'll need to contact the provider at your benefits, I'm sorry, after your benefits effective date for transition of care. This is for those in a treatment plan such as chemotherapy or have approved scheduled surgery. If approved by your provider, your services will be paid at the network level if it is a covered service. This is not intended for things like routine care or stable conditions. Now, this exception will not be permanent, but your provider will let you know how long you have before you need to get to a network provider or transition your care to a network provider. We encourage you to transition to a network provider as soon as possible, though. One condition we really address through this is pregnancy. Anyone enrolled in the plan in their second or third trimester as your benefits effective date and the provider is not listed in network, please contact your new provider for approval to use this provider through delivery. But, and this is a very important note, you must pre certify with your new carrier for the claims to be covered at the non HCA healthcare facility. If you're in the first trimester, you're going to need to find a new network provider. And again, your new carrier can assist you with that information. You can also locate providers on the carrier's website after January 1, 2022. So the medical plan includes some prescription drug coverage, but these benefits are not administered by your medical provider. They're actually administered by OptumRx. As you can see here, it's mostly a copay with the exception of 30-day retail brand medications. I'm not going to go over all of this information because it can be very overwhelming. However, plan design information can be found online when you make your elections. You can also look that information up after your benefit effective date of 1/1/2022. So, some important notes about your coverage. We have a 30-day or a 90-day supply. Now, affiliated pharmacies that are not owned by Mission are part of the OptumRx network and can be used for 30-day supplies and 90-day supplies of non maintenance medications. The OptumRx formulary does apply, and you may want to talk to your doctor about a lower cost option if that drug is not covered and is considered part of the formulary. Generic medications are definitely an option, and they'll be categorized into preferred and non preferred. Preferred generics will still be free, but non preferred generics will have a reasonable copay. And of course, OptumRx is going to send you detailed information, including a welcome kit, your prescription ID card, and then you're also going to receive the formulary information. So that should answer a lot of your questions. However, if you have other questions that aren't answered in those documents, you can certainly contact Optum. And at the end of the presentation, I'm going to provide you some contact numbers. Or go to hcarewards.com and enter OptumRx in the search box to get more information. Some of our options that we have available for health benefits include the behavioral health benefit. Now, these are included as part of your medical plan and have similar benefits, but these benefits are administered by Optum Behavioral Health. It's really important to note you will need to use an HCA healthcare affiliated facility to receive the highest level of benefit here. So, some talking points about the well being resources that we have available to you or that will be available to you as of January 1. Some things that you currently have or may be aware of um, that are provided through Optum Wellbeing, focusing on your finances, emotional well being, managing your family and household, and then medical care. And then there's some other options below, such as your overall health, building relationships, focusing on your career, and then things about your child's education. Now, there is a new resource that's going to be available to the North Carolina Division colleagues starting January 1, and it's the Optum Wellbeing Services. This is for emotional, financial, and legal counseling, as well as Optum Work Life Family Support, Sanvelo and Talkspace apps, Motivation Alliance Wellness Platform, the Quit for Life Tobacco Cessation Program, And lastly, Consumer Discounts Program, which is available to colleagues through hcarewards.com. So, some keys to coverage, including pre certification. As with your current plan, you must call your new claims administrator prior to certain services, 5 days before all inpatient hospital services, before receiving any outpatient service at a non HCA healthcare facility, or receiving care from an out of network physician, within 48 hours of emergency admission, 5 days before stays that last over 23 hours at an ambulatory surgical center, for durable medical equipment purchases that are more than $1,000, obesity surgery, and for behavioral health before receiving any inpatient, non HCA healthcare outpatient or applied behavioral analysis services with Optum Behavioral Health. So now let's talk about some dental benefits that are going to be available to you during your enrollment period. MetLife is the claims administrator for most of our common dental plans. We have two MetLife plans available. It's a basic plan and the premium plan. Really, the difference is that with the premium plan, there's a higher maximum for orthodontia and a higher annual maximum benefit. Both of these plans are PPO plans, which means you can see any dentist you choose, but you will receive a higher level of benefit if you use an in-network dentist. You should re- you should review your eligibility options on Be Connected during your enrollment period. So when you make your enrollments, be sure to look at the eligibility options available to you, as some may be eligible for other dental benefits based on your location code. So, vision benefits, we offer one plan of vision benefits, and that's managed through Ahmed Vision Care. So, they have a large network of participating retailers that includes Lens Crafters, Pearl Vision, Target, and many, many more. Enrollment and vision coverage also includes access to hearing care discounts through Amplifon. So, more information about that will be available on HCA Rewards during your enrollment period. HCA Healthcare offers flexible spending accounts for both healthcare and dependent care. You'll also see it called Daycare FSA. FSA accounts use pre tax dollars, and the healthcare FSA can be used on eligible expenses such as copays, coinsurance, eyeglasses, eye exams, contacts, and some eligible dental services. You can also use FSA dollars on dependents that may not be covered under your medical plan. For 2022, the maximum contribution that you can make to your FSA for your healthcare FSA specifically is $2,750. If at the end of 2022 you do not use all of your $2,750 or whatever election you make, you may be able to carry over $550 of any remaining balance in your healthcare FSA to 2023. All claims for 2022 services must be submitted no later than March 31st, 2023. For daycare FSA, you can use this for expenses for children who are under the age of 13 or dependents of any age who are not capable of taking care of themselves. The maximum household amount you can contribute in 2022 is going to be $5,000 or $2,500 if you're married and filing separately. There are some other limits that could apply, and you'll be able to see that information when you log into HCA Rewards and make your elections. If you have any questions, certainly reach out to Be Connected, which is the plan administrator for benefits, or you can reach out to Optum Financial, which is the benefit administrator for the FSA plan specifically. Similar to the healthcare FSA, the amount you elect is annual, and it's very important that you understand and consider your needs for 2022 when you make your election. It's important to not elect more than you're going to use because any funds over 550 in the healthcare FSA or any funds over zero in your flexible spending account for daycare will be forfeited at the end of 2022 if they're not used. Again, any questions related to your flexible spending accounts, please reach out to either Be Connected, which is your benefits administrator, or Optum Financial, which is the flexible spending accounts administrator. So some key notes about about flexible spending accounts. You must enroll in these plans every year. They do not roll over. We're not going to roll over any information from your current flexible spending account with MedCost, I believe, is the current provider. So it's very important that you make these elections during your enrollment period with HCA Healthcare. You can be reimbursed directly to your bank account by signing up for direct deposit with Optum Financial, but it's very important to do that during your enrollment period, or you can go on Optum Financial and set that up at a later time. Also, keep all your receipts since you may be required to submit receipts to verify expenses. And Optum Financial is actually the administrator for both the healthcare FSA and the daycare FSA. So there's 3 different ways to use your FSA. Those enrolled in an Optum Financial FSA will receive an Optum Financial card. There's an example of the card you'll receive here, and you're going to use that like a credit card to pay for health services. Be sure that the card is activated, and this once activated can be used and is valid for up to 3 years as long as you remain enrolled. There's a Pay My Provider option, which allows for online bill pay, which is ideal for things like recurring expenses. If you have, let's say, orthodontia expenses, you can set that up as a recurring expense. And then with the Pay Me Back option, it's going to allow you to submit receipts for expenses that were already paid. Now, once approved, Optum Financial will reimburse you for the cost. You're going to receive communications about the claim once it's completed. So here's some information about the flexible spending account of how to access your accounts. You can go online through HCA Rewards, and then you're going to select FSA or HRA. You can also download the Optum Financial mobile app from the App Store or Google Play. And then there's a phone number here listed to contact Optum Financial directly starting November 1st. Now, any calls prior to then would not be, they're not set up to answer until November 1st. So be sure that after November 1st, this is who you would contact. HCA Healthcare offers a variety of life insurance options. All full-time employees are offered company-paid life insurance of 1 times your annual salary. Supplemental life is available for you up to 8 times your base pay, and the cost is based on your age and your salary. We also offer dependent life for your spouse and your children. Being new to HCA benefits, all enrollees will be able to enroll in supplemental life up to 5 times base salary without an evidence of insurability, also known as an EOI. Any increase to supplemental life at a later time will require an evidence of insurability. Now, how EOI works is if you're enrolling online, an option and the link to answer EOI questions will appear at the end of your enrollment. Otherwise, a paper EOI form will be mailed to your home address in a Prudential or Be Connected envelope. So it's very important to look for those documents so that they're not missed. Complete them and return them to Prudential so you can ensure your coverage is implemented. Short-term disability is also offered to colleagues. HCA Healthcare pays 100% and it's up to 100% income replacement. That's based on your years of service. When you make your enrollment, you'll see what your eligibility is for your short-term disability. But keep in mind, Mission Health years of service will be transferred to HCA Healthcare plan to determine eligibility. Colleagues with less than 5 years of service can enroll in an additional 20% of coverage. You'll hear that we call it as the buy up option for the short term disability or the supplemental short term disability. You'll see that option available when you make your elections online. An important note here is regarding those who are currently receiving short-term disability coverage. So colleagues who are currently receiving short-term disability coverage prior to January 1 will continue to have your short-term disability administered by AFLAC. And then if you become disabled on or after January 1, your short-term disability will be administered by time away from work. Long-term disability is automatically enrolled at 60% for all colleagues, but during your enrollment period, you'll have the option to decrease your coverage to 50% or opt out of the benefit entirely. Now, keep in mind, long-term disability has benefits that pay you should you become disabled for 21 weeks after let me clarify that. After you become disabled and remain disabled for more than 21 weeks. An important note about long-term disability, though, any time spent under your Mission Health System's long-term disability plan, we're going to count that towards your HCA Healthcare's 12-month pre-existing condition clause. Similar to life insurance, if you don't elect the coverage when you're new to HCA Healthcare, you will have to go through EOI or evidence of insurability if you enroll at a later time. Now we're going to talk about some finance information for you. Again, we talked a little bit in the beginning about what this includes, and that's our supplemental health plans, the 401k plan, and then even the employee stock purchase plan. So supplemental health plans are offered through United Healthcare. Now, these plans pay cash benefits to colleagues who may use it to pay for medical and non-medical expenses resulting from a covered event. We have 3 different plan options to choose from. The first plan is accidental coverage, which covers expenses related to an accident requiring medical care. Then we have critical illness. This covers expenses related to a more serious illness or condition. And then lastly is the hospital indemnity plan, which covers expenses related to a hospital stay. Colleagues can receive an additional 25% cash benefit for certain covered services when you use an HCA healthcare provider. To be covered for a critical illness diagnosis, to be covered, a critical illness diagnosis, accident, or hospitalization must occur after the benefit's effective date. If you enroll during your annual enrollment period, your benefits will be effective January 1, 2022. So any claims that are filed would have to be for an occurrence that takes place on or after January 1st, 2022. So the 401k plan, we talked in the beginning kind of about who was eligible. We know that full-time, part-time, PRN colleagues are eligible as long as they are over 18 years of age. There is no waiting period for eligibility for any colleague who is acquired as of the December 31st date. Any colleague that's hired on or after January 1st, 2022 will have the waiting period of their eligibility will be the first of the month following 2 months of active service. Colleagues are going to be eligible to contribute between 1 and 50% of the eligible pay each pay period. So when you make your election, you'll be eligible to participate up to 50% of your eligible pay from HCA Healthcare each pay period. You can elect to invest in funds of 1 to 19 professionally managed funds that are available to you. The HCA Healthcare plan is one of the most generous plans in the industry and offers a 100% match on 3 to 9% of your eligible pay. As you can see, there are a lot of details here about the plan. One key highlight is on January 1st, North Carolina Division colleagues will become part of the HCA Healthcare plan. The first year you will be eligible to receive the company match will be 2022, which will be applied to colleague accounts who meet the eligibility requirements in 2023. So let's talk about some eligibility requirements. To be eligible to receive the company match, you must work 1,000 hours during the plan year and be employed with HCA Healthcare as of December 31st, 2022. When you receive your enrollment kit, you're going to see quite a bit of information about the HCA 401k plan, how to make your contribution elections, and what your match tier will be. As I noted before, it's very important to note what the requirements or eligibility requirements are for colleagues to receive the match. So let's talk about that again. To receive the annual match, you must be employed by an HCA healthcare affiliated facility on the December 31st of that plan year and have completed at least 1,000 hours of service. Now, not all type of hours that you work count towards the match. You can check your hours a variety of ways. Either you can do that by going online, reading your quarterly statements, or calling Be Connected directly. Some notes on the match: death, disability, or retirement as defined in the summary plan descriptions. Some colleagues who receive this will receive the full match regardless of their separation date or number of hours worked. More information can be found in the summary plan description under the employer match or the company match section of the document. We do accept rollovers from a prior employer's retirement plan or qualified IRA. Please note that this will exclude your current 401k plan with Transamerica. We're going to automatically merge your Transamerica account into the HCA 401k plan later in 2022. However, if you have a plan outside of your Transamerica 401k plan that you'd like to transition over to HCA's 401k plan, we partner with Retirement Clearinghouse to make that consolidation easy for you. Their information is here. HCA Healthcare also thinks that it's very important for colleagues to save towards retirement, and they make a 401k contribution for eligible colleagues who have an income at or below 205% of the federal poverty guidelines, are also employed by an HCA facility on the first and the last day of the year, and work at least 1,600 hours during the year. This is also known as ERAC, or the Employee Retirement Assistant Contribution. For 2021, HCA Healthcare contributed approximately $2.1 million to about 2,400 eligible colleagues' 401k accounts. For those of you who are eligible, you will be notified of your eligibility upon the contribution being made. So as I said before, the Mission 401k plan with Transamerica is going to be merged with the HCA 401k plan at a future date. So your current contribution elections will not be transferred from your Mission 401k plan to HCA Healthcare. You will need to either make an active election or be defaulted to participation in the HCA 401k plan. The default rate is 3% per pay period, and any contribution made will be placed in our 25 to go fund. So here's some details about the upcoming plan merger of your Mission 401k plan into the HCA 401k plan. Right now, a final date has not been determined. However, we will ensure that you are notified prior to that transaction taking place. You will receive a blackout notice prior to the merger that will explain the timing and process of fund mapping that will be completed on your account. Employee stock purchase plan is available to colleagues, and at this time, even Mission Health colleagues have access to this benefit. The next opportunity to enroll in this benefit or take advantage of this benefit will be in February, from February 1st to 15th of 2022. If you are currently not enrolled with Mission Health in the employee stock purchase plan, your next opportunity to make an election that will impact your Mission Health deductions is November 1st through November 15th, 2022. So let's talk about some other benefits that are available to you, such as education assistance, some well-being resources, time away from work, we talked about a little bit earlier, Core Plus voluntary benefits, and then even some additional benefits that are listed up. So education assistance, the programs that are offered to you are a variety of them. We have tuition reimbursement that is up to $5,250 in reimbursement each calendar year for eligible tuition expenses. We also have an option to help you repay student loans for degrees that you've completed. The student loan assistance is offered as a monthly benefit of $100 towards your loan for full-time employees or $50 a month towards your loan for part-time employees. There's also a certification support, which offers prepaid vouchers or reimbursements and bonuses for completed certifications beyond what is required for your position. We also have additional resources such as scholarships, college scholarships for children, college advising, and some financial coaching available to our colleagues. HCA Healthcare also has a variety of voluntary benefits where you pay the full cost of the coverage and the cost is deducted from your paycheck. Some of these voluntary benefits include LifeLock identity theft protection, legal coverage, voluntary life insurance, home and auto, and even pet insurance. You can find more information about these plans available to you on hcarewards.com during your enrollment event. Here's a list of some other benefits that are available to you as you become eligible for HCA healthcare benefits. AirMed offers free medical transport to an HCA healthcare facility if you're more than 150 miles away from home. This benefit is offered to colleagues who are enrolled in a medical plan. There's no deductible, no copays, no claim files to form, and there's no pre-existing condition restrictions or financial limit on evacuation. The full cost of this benefit is covered by the HCA healthcare medical plan that you enroll. We have adoption assistance, which offers help for adoption expenses. You're eligible to take advantage of this after 1 year of full-time employment. Bright Horizons has Sitter City and Years Ahead access to help with childcare needs. We also have consumer discounts for a wide range of products and services. And lastly, Motivation Alliance is our partner in helping our colleagues achieve your wellness goals. So let's talk about how to enroll. On or around November, I'm sorry, October 31st, November 1st timeframe, you're going to receive your enrollment kit. This is going to include the benefits plan highlights, your paycheck deduction cost based on the options that you have available, and the enrollment instructions. It's very important that you enroll by the deadline to ensure that you have coverage or you'll receive default coverage. Also want to note that if possible, it's very important to enroll no later than November 19th. That will ensure that you have active coverage on January 1st and you'll have ID cards that will be received in time. So, to enroll online, you must request a multi factor registration key. This is going to be done by going to hcarewards.com on October 25th or after, and then selecting register as a new user. You're going to follow the prompts to either have a key emailed to your HCA Healthcare email address or mailed to your home address. Once you receive the key, you'll follow the instructions to register that key and set up your account. Once registered, you're going to select a Benefits Enrollment Center to learn more about your benefits. There's a screenshot here to kind of give you an idea of what that's going to look like. From there, you'll select Enroll Now to make your benefit elections. This will take you to the Be Connected website to make your enrollment options. If you have any questions or concerns or have any issues, you can certainly call and speak with a Be Connected representative. They're available Monday through Friday, 7 a.m. to 7 p.m. Central Standard Time, and their phone number is listed here. Again, it is absolutely important that you enroll by your deadline. It's more important to enroll by November 19th to ensure January 1 coverage and ID cards available in hand. If you enroll dependents under your benefits, you will need to make sure that you have their full name, their date of birth, and their social security number. After you enroll your dependent, you must provide documentation to verify they are eligible for benefits. Information on who you can cover is available to you on hcarewards.com. You can upload your documents from your computer directly to Be Connected. This will allow for faster review and determination of eligibility for your dependents and avoid any concerns about your dependents being dropped. You must submit your documents within 31 days of your enrollment date, or your dependents are going to be dropped from coverage. After enrollment, it's really important to stay connected. HCA Rewards is your landing space for